Choosing the wrong behavioral health EHR software locks your treatment center into years of pain. Years of workarounds, billing inefficiencies, and clinical documentation friction. And some platforms claiming behavioral health specialization are generic EHRs with a configuration layer bolted on top. This guide compares 6 platforms operators encounter most: Behave Health, Kipu, Sunwave, Aliva, Best Notes, and IK Notes. We will cover what to look for, how the platforms stack up, and 5 steps to choose the right one. Behavioral health faces a challenge acute care hospitals never encounter. Documentation requirements, billing models, regulatory frameworks, and clinical workflows in SUD and mental health care are distinct enough that general-purpose EHR platforms create more friction than they solve. Dozens of vendors claim behavioral health specialization. Some are purpose-built. Others are general-purpose EHRs with a configuration layer bolted on top. Selecting an EHR is one of the highest-impact operational decisions a behavioral health organization can make. The wrong choice means years of workarounds, billing inefficiencies, and clinical documentation friction. The right choice streamlines operations from day one. Here is what purpose-built looks like. Behave Health unifies CRM, EHR, billing, and ERP in one system built for behavioral health. Clinical documentation is ASAM-aligned, with configurable treatment plan templates for residential, PHP, IOP, and outpatient settings. E-prescribing for controlled substances is included, critical for MAT programs prescribing buprenorphine or naltrexone. And it is designed to support Part 2-oriented workflows directly: granular consent management, segmented access controls, and audit trails for SUD records. Hundreds of behavioral health facilities run their operations on it. Whatever platform you pick, evaluate these capabilities. Group note creation, document one session, and apply individual observations to each participant. Drug testing integration, so results flow into the clinical record instead of manual entry. Real-time bed management and census tracking for residential programs. And outcomes tracking with validated instruments like PHQ-9, GAD-7, and CSSRS. Payers and accreditors increasingly require them. So, how do you actually choose? 5 steps. Map your model. Weigh all-in-one versus specialized. Check compliance, total the cost, and demand a real demo. Step 1. Map your facility type and clinical model. It determines which features are essential. Residential programs need bed management, medication pass workflows, and group therapy documentation. PHP and IOP programs need level of care documentation aligned to ASAM 2.1 and 2.5. Multi-site organizations need centralized reporting and role-based access across locations. Step 2. All-in-one versus specialized tools. All-in-one reduces integration complexity and gives you a unified record from first inquiry through alumni engagement. For most organizations at 20 or more beds or clients, an all-in-one platform delivers better operational efficiency than stitching tools together. Step 3. Prioritize your compliance requirements. HIPAA compliance is table stakes for any healthcare EHR. Part 2-oriented workflow support is mandatory for SUD treatment records, and it requires capabilities beyond standard HIPAA protections. Accreditation standards from CARF, the Joint Commission, or NCQA, plus state licensing, may dictate specific documentation workflows. Step 4. Assess total cost of ownership. The sticker price is only part of it. Factor in implementation, data migration, and training for clinical, billing, and administrative staff. Watch for add-on fees for e-prescribing or telehealth, and integration costs for external systems. A platform that looks inexpensive per user can become expensive once add-ons and workarounds pile up. Step 5. Request a clinical demo, not a sales demo, and bring your clinical director and billing manager. Watch them create a treatment plan for a residential client stepping down to IOP. Document a group session with 8 participants, run a VOB, and generate a utilization review document. If the vendor cannot demonstrate these workflows live, that tells you something about the depth of their specialization. Behave Health was built from the ground up for substance use disorder and behavioral health. CRM, EHR, billing, and ERP in one system. Admissions pipeline, clinical documentation, claims and denial tracking together. Bed management, integrated drug testing, alumni tracking, and a patient portal are included by default. It is designed to support organizations from startup through multi-site expansion without migrating to a different system as you grow. Stop running your center on years of workarounds. See the all-in-one platform against your own clinical workflows. Schedule a demo at behavehealth.com. Bring your clinical director and schedule a demo at behavehealth.com.